right, I'll let Bill and Denise kind of figure it out. Since you guys can hear me, I'll just roll. Okay, right. You guys with me? Fasten your seatbelts. We got some updates here for you. Bill's going to pop up my PowerPoint. And just so you know, that was me before COVID. You know, you kind of get it, the COVID hair, the COVID nails, all this. Yeah. So you're really seeing the natural Nan here. But it's a privilege and honor to be here, to be the first event presenter. So Bill and Denise asked me, hey, is there some stuff that I could share? Absolutely. I've always got stuff to tell you guys. So we'll go ahead and we'll roll my tape here. So one thing, and this is, I usually gauge like what you guys want to hear based on how many questions I get. And a lot of the questions I get is about how can I protect my face? And that's facial protective equipment, okay? Looking at that, and I get that. We all want to protect our face. We all got to wear the masks, right? So one of the first things you should do is you should wash your face. Make sure you have everything off of it. No moisturizers, no serums, no petroleums, oils, or anything, okay? Just make sure you wash it really, really good. And then we will hit the slide. And this is where, okay, I took her face, the model, and I put these blue marks on her just so you guys will know where to put your skin sealant or barrier. Whatever you guys have is fine, okay? I just want to make sure that it protects you. So you want to go here, across your nose. If you have a headpiece or whatever, you know, you're wearing one of those shields, you can have it across your forehead. Some people put it on the chin. I don't, because I always have my chin covered. So, but those are the key areas where you want to put your skin sealant. Once you put it on, kind of let it air dry a little bit, okay? Because you know, kind of gets, kind of let the alcohol or whatever that stuff is to burn off. And then we'll click the slide. And a lot of people want to do like their own templates, or they'll do like a pattern. And I think that that's a great idea. So what you see here is just a pattern that I made with cardboard paper. So the first thing that I want you to do is kind of just measure where you want to put these. So say across the forehead, okay? So you want to measure that out. You make your template. And then I'm choosing a thin foam. A lot of people have been talking about foam. I would suggest a thin foam, okay? And a thin foam would look like this. Look how thin this foam is, right? I mean, that's pretty thin. This does not have any adhesion on it, around it, okay? There's no adhesive border. So the reason why I picked this, it's a 15 by 15 size because I got to make a lot of patterns. So I'll take my little pattern and I'll just cut it out, just like the picture. And then for my ears, because I want to protect my ears, okay? So I also made a little pattern for that. And that's what that is right there. So you want to cut them all out, have them ready. You can put them on a Ziploc baggie if you want, so that way you always have them. And so that's what you would want to do. Now this is called, actually the name of the product is on there right now. And this, for clinicians, you can always get it at bandageplus.com if you just want it for yourself. But if you want it for facilities, you would get it from Medi USA. And they're the ones that will work with the accounts and facilities to supply your hospital or agency with. But that's pretty much what it is. Now, one key thing about this particular one is it has this contact layer that's silicone. Now, when I say silicone, silicone's hot. I've been talking about it for years. Everybody is moving to silicone. Why? Because you can put silicone on you. Here you go. Here's one of these. You can put silicone on you and you can take it off so nicely. This is skin friendly. It's wound friendly. When you get this and say that you're crooked and say you end up putting it like this, oh my goodness, it's stuck on my hair. You know, normal kind of dressings, you don't want to pull this off your hair, but this has silicone. Look at this. That's it. That's it. So this will not hurt the skin. So this is why I would suggest going with a silicone product. So whatever you have at your facility, or you can get some of this. So that would be what we would use for foam. And the next picture will show, well, that's how I did it with her forehead. The next picture is just doing it with a silicone tape. Now, have you guys used silicone tape? I'm going to ask a question. You guys, I'm going to watch the chat box so you can answer me. Okay. You guys use silicone tape now? Okay. Now, silicone tape comes in all different sizes. This is silicone tape, which is pretty thick here. And then we also have one that's thinner. Okay. I tend to like the one that's thinner that you see on the screen. This one is 2x3. It's very soft. It's skin friendly. It's wound friendly. You stick it in your hair. You can take it off. It's not going to hurt. It's okay. I love this because I don't have to have my scissors when I use this product. This is already perforated. So if you see my picture with the blue gloves, notice how they're pulling it apart. That's what perforated means. So that means they can just take it and just cut it like that. Now I measured these, and these are exactly right on the money, 5 centimeters or 2 inches, whatever you guys go by. And it's perfect for the nose. This is perfect for the ears. And then for your cheeks, what I did in the model is I used 2. So I did 2 of these, a little bit longer. So that would be what, 10 centimeters? Yep. And then you can just put it right there, right on top. Another thing I like about this is it's, the color's pretty nice too. I mean, the color kind of blends in quite nicely. And as you can see, it just stays down very nicely and conforms. So when you put your mask right on it, see that model right there? She's smiling. You could tell that she's smiling with her eyes there. She's really comfortable. The mask is not pressing in her flesh, and she's not breaking down. So that's the beauty of that. Okay, I'm reading that some of you guys have the silicone tape and some of you don't. This is hot. Get samples. If you guys have never tried silicone tape, get samples. I'm telling you, it'll change your life. And you can put it on the patient. I don't know how many times a day, and you're not going to hurt their skin. You will not strip the epidermis off. All right, so the next slide I have is, hey, Janet. Janet Kovach used to be one of our instructors. That's who just joined us in the chat room. Always nice to have alum here with us. Here's just some pictures. I really think, I always think nurses, clinicians are so creative, because when this first started, we had those masks, and then they were coming up with putting them with a paper clip behind their head, or maybe like this one lady, she had like little pigtails and wrapped it around there to keep it in place. The young boy is the one that created those little devices, and that's what connects the two in the back of the head. So those are available too. I also have some more pictures for you. On the next slide, you'll see very creative. They sewed buttons on headbands, or they made little, kind of like a little fabric piece in the back with buttons, and they just connect in the back. Even the guys got in on it too. So very, very creative stuff. But here's some medical stuff that was already created to protect the ears. One product is called Oxy Ears, and that is the foam one, and it has a slit in it, and you just slide it right on. And I think if you can kind of see, that's the company where you could get the Oxy Ears from, American Medical Products. Then there's some cannulas that you can wrap behind the ears as well to protect them. But then a lot of my alumni have told me, they're like, you know what? We don't have problems with the back of the ears breaking down anymore because we went to silicone. Well, bingo, there's the word, silicone. So they changed everything over into silicone. So now they have no breakdown at all whatsoever behind the ears. So that's good, helpful information too. Okay, well, hit the slide. And one thing, okay, and take care of your lips. You guys are wearing these masks, you're breathing in your own air, and it's just like, you just feel terrible. It's, your lips start cracking. You don't want that. So exfoliate your lips. If you don't have a lip exfoliator, that's fine. Go to the kitchen, get some sugar, and just rub it on your lips, guys. Get rid of that dead skin. Yeah, get rid of it. Get it down to where it's really smooth, and get yourself a really good lip balm. A real good lip balm that's just going to last for a long time, because you want to protect those lips and stay hydrated. See, look at this. I got my big red cup here. And no, there's no vodka in it. Happy hour starts after this, guys. So, but yes, definitely do that. And then in regards to pressure, if you can remove the mask or start lifting the sides and giving some relief, remove the mask every 2 hours for about 5 minutes at a time if you can. Ideally, if you can just do 15 minutes off for every 2 hours, it'll protect your face. It'll help you. Mm-hmm. So just keep remembering that. Just like we do with our patients, we like to offload them on pressure. We need to do the same thing with us to take care of our faces. Okay. So one comment in regards to N95 masks. So everything that I just said was just talking about generalized masks, okay? This piece here is just some tips in regards to the N95 if you're wearing N95. Dressings, tapes may alter, so make sure you check the seal of the mask. Be very careful. Thin dressings may impair the function of the mask. Now, what I've seen on the forums, and I'm pretty connected social media-wise, I follow lots of different forums because that's the way I can learn things. And a lot of people are saying, hey, no, I'm using a thin hydrocolloid on my face, and it works really great. And I go, you wearing an N95? And they're like, yeah. And I go, no. Even the people that make the hydrocolloids will not back you up. They will not say to do it because they don't have studies to say, yep, it's okay. So I'd rather you always need to yourself check the seal every time you put that mask on. Don't take somebody's word for it. Oh yeah, I use hydrocolloid. Don't do it. So check it. So both hands, cup your mask, your N95 mask, blow into it. See if you feel air coming from the sides. See if there's any leakage. It's your responsibility to always check that seal. So that's why I was talking about those skin sealants. Those are really good. If you're you could always try that and see if that might help. But definitely remove it 15 minutes at least every 2 hours if you can. And then when you're taking off your N95 mask, be careful when you're removing it. And this kind of reminds me of something that I know you guys will connect to. Whenever you take a wet to dry dressing out of a patient's wound, you know that it emits like all these thousands of bacteria right into the air, okay, because we were all taught that. Well, when I think about taking this mask off, I'm thinking, I'm taking that mask and I'm moving myself away from that mask. I'm not breathing. I'm not going to inhale. I don't want debris. I don't want particles that I'm breathing in. So kind of think about it that way, okay? So just take it off, just keep it, take it away. Dump it, put it somewhere, wherever you need to put it. But make sure we don't inhale any of that because that's not good. Next slide. So there is some great references out there. There's tons of references, but these are, of course, my favorite too. One is from the Wound Ostomy and Incontinence Nurses Society. They just released this that you see here on the screen on the left. That's a very, very nice write-up. And then also the National Pressure Injury Advisory Panel, which they changed their name recently. So it's NPIAP. They made an infographic, and that's what you see on the right. And an infographic is a way to condense information, make it 1, 2, 3, A, B, C, so people get it. And that's what we want people to do. We want them to get it. We wanted them to learn it right away and start doing this. So I pretty much followed both of these guidelines as I kind of put my PowerPoints together today. Okay. So a lot of people are asking me, what's going on with Wound Care Education Institute, WCEI. What's happened? We haven't heard from you guys in a while. And, what's going on? How have you guys been since this COVID thing going on? Well, like I said earlier, wound care and learning never stops. It's always going on. And so we had to take a look at our company and go, hey, this is not the time to do live. But what we did was we created our program into live online. What does that mean? Well, a lot of people ask me that because sometimes they think it's just an online program. Absolutely not. Where you are today, you're looking at me with a computer, right? And you hear me talking, and I could answer your questions. That's exactly very similar to what a live online is. You have a live instructor in the corner somewhere on your screen, and then you also see a PowerPoint slide. So what you see is a very good taste of what that might be. Now, these instructors can answer questions. I know Joy Hooper, she's actually in the chat box, but she does live online as well, and she's our ostomy instructor. She gets right up in there with her apron, and she talks about all the different surgeries and how to pouch things and all these other considerations. And there's a lot of, it's just like being in front in a live audience, but you're doing it at home. You can do it in your PJs and your big red cup, and no one would know, you know? Anyway, so I'll tell you a little bit more about that, but I have to say that I feel that this is the cream of the la creme. It is all the instructors that are doing live online are not podium speakers. This is not taped and they push the button play. This is Denise, this is Bill, this is Joy. You know, these are instructors that have been doing this week after week after week. They know what they're doing. They're energetic, they're dynamic. And I'll tell you, these guys are so fun to learn from. They really are. Next slide. So again, here's some skinny on it. We've got the skin and wound management program live online, but also ostomy. Yes, ostomy. Many people said, hey, listen, you know what? I can't get to that live ostomy course out there in Santa Ana, California. Is there any way you could do it online? Yes, we made it happen. And so Joy has been doing this, and we are getting great reports from the students that have been taking it with her live online. So that might be a consideration. I know many of you that are online with me right now, you guys are our alumni. You know, maybe this is a great opportunity since maybe some of you are furloughed or maybe you're not, you know, maybe you got some time off or whatever. This is a good time to learn, you know, and maybe you want to get dual certified. Maybe you've already got your W, but now maybe you want your ostomy too, you know, so might be a good option for you. So what this looks like is 4 days full online, just like you would run in a live course, or if you prefer, 8 evenings. So it would be 8 business, you know, be business days. So it'd be in the evening, and it's about 3.5 hours a night. And Denise, I understand that you just love doing this with those students, and you do something a little different. What is that with the?
I do. I love the life online. I'm one of the newer instructors, and I started in the evenings, and I found out, you know, these guys are working all day, and then they're still coming to class. And so I am just so honored that they will share their time with us. And, you know, I enjoy interacting with them. I enjoy, you know, putting them, we chat, you know, we talk in the chat boxes, but we also unmute, we talk, you know, just not face to face, but voice to voice. And I have just really enjoyed those classes.
That's awesome. Hey, I just saw a comment from Hershey. She asked, are the fall courses scheduled in Vegas still live, or will they be transitioned online? Right now, they are live. So those are the ones that you're talking about that's going to happen in September. Yes, they are live, and I will actually be there. And actually, we'll be also having WOW in September as well, which I'll tell you a little bit about here in a second. But yes, Hershey, the classes will be there. So that's your diabetic course, the wound course, and the ostomy course. And then all the instructors will be in Vegas as well. And then we'll go ahead and go to the next slide. People ask me about Donna Sardina, and here she is, and she is very happy in Texas. She's there with her dad, hanging out with her dad, and she's dressing her 2 dogs up. She just got done writing a fabulous program for us, and what it's going to do, it's probably a 5-part program in regards to all the new guidelines that came out. Now, just heads up, you know, NPIAP or NPIAP, they released the new guidelines back in 2019. And so Donna created the program, and Donna is in the house. Donna, hi.
Hey, Donna.
Yeah. So right now we're working on getting this. We'll be going virtual with the program that she wrote. So I'm trying to coordinate some times so we can do that this summer. So that way you guys can all stay updated. So that's Donna. She's doing good, and Big Wound Care, hello to her. And the next slide, here's WOW. Let me tell you a little bit about WOW. Well, because of what's going on, we are going to go virtual. Yep, we're going to go virtual. And so a lot of people are asking me, well, what does that mean? Because I'll be honest with you, Nan, everybody and their brother is asking me to go to a webinar, to join a webinar, to join a conference, and everything is virtual and all this. You know, how's WOW going to go virtual? I mean, because like WOW is like full of people that network, and we love to dance, and we just love to share information. I mean, we're a very close-knit group. How's that going to work? It's going to work, guys. One thing that we do is we have the wow factor and nobody else has it. They just haven't figured it out, and that's okay because we got it. And we are going to be going virtual in Las Vegas, and it's going to be in September, and I have the details, and you are going to be the first one to know. This is not even out in the public yet, so feel free to take a picture of my next slide. Go ahead. Oh, no, you can take a picture of this. This is what I want you to see, okay? I don't want you to think that this is just a webinar we're giving you in September. It's not. You're going to be walking into a national convention. Take a look at this. Now, this is just a sample. This is not the real WOW, okay? Because I can't give you everything. But this is somebody else's convention, but you walk into the library, and it's like big, and it's, look, and they got the vendor, different signs out there. This is exciting. You can look around and look at all these different people, and you can go to the exhibit hall, or you could just chill out in the lounge. Or if you just want to play a game on your phone, you could play a game on your phone. But this is kind of what it looks like. What do you think about that, Renee, huh? Good. Well, I'll tell you what. So what's the next, let's show them the next slide, Bill. Okay, so this is just kind of giving you just a little about maybe what the exhibit hall looks like. Now, there's going to be 40 exhibitors. That's just how it works in virtual. That's the most that you can have. So, I mean, we had over 100, but unfortunately, we had to make some cuts because I only could do 40. But there's going to be 40 vendors. We're going to have plenty of exhibit times. They're going to have their, exhibits opened up, and they're going to be open every day. So you'll be able to talk to them. So then a lot of people tell me, how's that going to work? Do I just go into some room and it's on the computer? I want to touch these things. I want to see these things. I want to be able to try them on and everything. And I'm like, you know what? You got a good point. Yeah, because one thing, when you go to WOW, you get a tote bag. You guys ever go to WOW to get a tote bag? Remember that tote bag you get?
I have a whole collection.
Huh?
I said I have a whole collection.
Okay, I do too. Well, I'll tell you what. Those that sign up right away are going to get a tote bag. And it's going to be sent to your house. Yes. And you're going to have samples so you can touch and feel and see. That's the WOW effect. No other convention's doing that. We are. We're going to do that. Because we really believe that if you're going to learn, you got to be able to know what you're doing, and how to put these products on. So the vendors will be there to help us. They have videos and cheat sheets and stuff, and they're great. They can also meet with us if necessary. Yes, samples, absolutely. I see some smiley faces. That's good. I'm feeling the love now. But yeah, so it's the best we can do based on the circumstances. Okay, but as far as I'm concerned, this is going to have the wow factor. You guys are going to get tote bags. The first that sign up are going to get it. You're going to get the samples. And remember that workbook that Donna used to put the workbook together? Remember that? Remember how thick that workbook is? Guess what? You guys that sign up right away, you're going to get a workbook too. That's the wow factor. So everybody's going to have the workbook. I mean, I've got tons of years of workbooks on my shelf right now. So now you can still have that as a collector's item. So it's as wow as we can make it. And I'm just so excited. So I really hope that you guys sign up this year and bring your friends. The more, the better. I mean, because this is all virtual. A lot of people are asking me, well, how much something like this going to cost? Sometimes it's hard to fly to Vegas, but how much would this cost? It's going to cost less than $100. Did you hear that? Less than $100. Who goes to a national convention that's less than $100? And they're going to send you your book. They're going to send you your tote bag and all your samples. I think that's great. So I'm really excited about that. Next slide. All right, so this is just a screenshot of someone else's screen, but to kind of give you the feel and the vibe, because I want you to feel that energy. We're still going to have that energy. Now, one thing that these different conventions might do, they might take their speakers and then they just push play and the speaker talks. No. This is live wow, okay? I'm going to be opening wow with the first session, which is the Buzz Report. It's live on stage with lights, action, everything. I'm going to be with the instructors, so it's going to be as live as we possibly can make this. And this is kind of what the layout might look like. It'll be WOW branded, of course, but you'll be able to see the slide. You'll see the speaker or the speakers. If there's any demonstrations, you'll be able to see that as well. There'll be a chat box so y'all can kind of talk. And then you can also see like the PowerPoint below of like what might be coming up. So I think that's really neat, right? Renee, you're going crazy over there. I see that. Sold. Getting emotional. Yes. You know what? We made it definitely affordable. There's no reason why you can't go to WOW now. If we can get less than $100, it's time to go. For those of you that haven't been to WOW. Next slide. And see all those folks? I'm hoping all you guys are coming and joining us in September. This is, here is the details. Get your camera and snap a shot. So you got it. September 24th through the 27th, Thursday, Friday, Saturday, Sunday. 40 exhibitors, that's the max. That's all we can do. 20 CEs, that's a good chunk, right? 4 full days. The sessions will be recorded. Here's a big one. We're going to record them. You can view them for up to 12 months. Yes, 12 months, not 2 weeks, 12 months. We got you. We know you're busy. We know you got to work that time out. I want you to see all 20. You take your time. You got 12 months. And the tuition, I love it. Less than $100. Yay. That Starbucks money we have spent on lockdown. There you go. Okay, so next slide. Now, I pretty much kind of ended my little spiel. Now I'm at this slide where I get to turn around the mic. I love to turn around the mic. I'd like to turn it around to Denise and Bill, because what they have done is they started this company called Wound Care Gurus, and I don't know about you, but I want to find out about this. Number one, I love the name. Tell me why you guys started this.
Well, I was so excited to join WCI as an instructor. I'm one of the newer full-time instructors. And so I left my job in operations and program development. And of course, Bill and I have been teaching sharp debridement for several years. So we needed a new platform that we could call home, that we could bring the content that I've been teaching for so many years in the sharp debridement class and just bring it under one roof, and then be able to focus on things like learning today, doing tomorrow, and just all those, all this collection of work that we've had all these years.
That's awesome. That's great. Now, what are you thinking, what are your thoughts on what you're going to be offering?
Good question, Nancy. We're kind of going to be rolling our Wound Care Gurus out in several phases. Phase 1, we're going to be bringing out some webinars, more social media events like this. Potentially, we've even on the board right now, the testing board, potentially like podcasts, stuff like that, to just bring more and more information out to our fellow clinicians in the field, because more information makes you a better clinician. Phase 2 is what I'm really excited about as well, because one thing that we find is that there's a definitive lack of support for clinicians out there today in the field. You can get education is great, but what do you do when you can't find the answers? You don't really know where to look, or you've looked and you're like, well, I can't find anything out there. Where do I get this from? We are putting together a board, an advisory board of vetted wound care experts that clinicians will have access to for general wound clinical support. when there are questions, they need an answer. They need, where can I find this information? Where can I find a resource on this? We're putting together a board of super experts on all different areas of wound care. We're covering, from lymphedema, to venous disease, to burns. We're going to have, our goal is to put together and have at least one expert in every area out there. And then as well, on top of that, is we're going to actually also offer a platform for individual patient-specific consultation, where you'll be able to hire some of the board members, if you want to basically, hey, I need a consult on this patient. I'm out in the middle of nowhere. The nearest wound care center that I don't, whether it may or may not be a good one, it's 5 hours away. My patient can't get there. And I want to hire somebody, and we'll be able to work with some of these experts that are going to offer that type of a service to our clinicians, so that they can do that. And then, of course, the final phase, phase 3, when we roll out, and as what my wife kind of alluded to, is we're hoping to also start to fill the need out there in wound care with some live courses that there really aren't any courses on those areas. They're just lacking out there. I mean, there's a lot of, the WCI course is a great course. I've been an instructor with them now for 17 years. And
wow.
Yeah, I know, exactly. Probably the longest job I've had with any company in my entire career. But again, and it's been great, and it's still, bar none, I guarantee you folks, there is not a better 4-day comprehensive wound care course in the industry. Okay, I stand behind that, because we just recently, at WCI, updated the program and rolled that out last month in April. And I was blessed because they tapped me to help with the content and making sure we brought it up to speed. So I played a role in this, and some of the other instructors did as well too. So that is, the content is just awesome. But even with everything that WCI does, they don't cover everything, or if they do, it's just a kind of a gloss over of it, because they just don't have the time to dive deep into some of those areas like lymphedema, which is my wife. She's a certified lymphedema therapist. So there's areas we have identified in the industry where there aren't any live courses that I believe clinicians could really benefit from having. So we're hoping to fill that little niche in phase 3 of the rollout of our company. So.
Well, that's great, especially like lymphedema. Nobody talks about lymphedema much, and it's not always what they think it is. From what Denise has been teaching me. So yeah.
Even in our chronic venous insufficiencies, for me, that lymphedema training was when I had my aha moment of, oh, now I know how to get these guys better. The liposclerosis, things like that.
Mm-hmm. Well, that's awesome. That is awesome. So have you established your board already?
We have a list of people. We've got about a half dozen, 8 people that have agreed to be a part of it. And that includes, we've got some physicians, we've got therapists, we've got nurses. So we're trying to pull in the best people that we have met over the years, that we have networked with through going to the conferences like WOW and SAWC and stuff like that, and trying to find the best of the best. We still obviously have a few more areas that we want to fill in, so that is something that will be in development over the course of the next couple of months, so that when we roll out phase 2, we're going to have a really good comprehensive board that you will know. And the thing is, we're vetting them to make sure we know based on their background that they're practicing real evidence-based medicine. They're not just walking around with a title that I'm a wound expert. They can prove it and they back it. It's not about what, as I like to tell my students, it's not about the letters after your name. It's how you actually practice wound care, which really defines your expertise. You can put alphabet soup after your letter, but if you turn around and write an order for a wet to dry, I'm sorry, I'm going to question your expertise on that one.
Oh yeah, exactly. Well, that's exciting. Can you give us maybe like a little teaser or anything about maybe different events that are upcoming that you know of now, or?
Sure.
Yeah, we have next week we're going to do another Facebook Live event. Not only was it Nurses Week this month in May, and shout out to all those nurses. Thank you for all your hard work and for mentoring us all along the way. But May is also Speech and Better Hearing Month. And so I'm going to have one of my favorite speech therapists on with us live next week to talk about how speech therapy can really work with the wound care team. And if you don't have a speech therapist at your disposal, some of the things that a speech therapist would look at. Some tricks for when you're in a home health setting, or maybe you don't have access to a speech therapist, and looking at signs and symptoms of swallowing and what to do and strategies and how to improve nutrition and work with the dietitians, and just lots of, just a sneak peek, but lots of exciting stuff next week.
Yep, and then actually coming up after that, we've got a few other things in the hopper. We're actually going to bring on an expert in the antimicrobial stewardship area. There's some new molecular diagnostic testing out there called PCR, polymerase chain reaction. I know that sounds really fancy, high tech, and I couldn't explain it, so I'm going to bring on an expert who can. So, and it's kind of some new radical technology that's going to help, I think, may change our approach to how we actually are managing as well as identifying the microbial load in the wound. We've got another one I'm bringing on. Some of you may know Dr. Michael Miller from the Miller Wound Care Group. We're going to be having a great talk about Kennedy terminal ulcers and really just diving into the pathophysiology behind that. And, is it, skin failure, pressure injury, combination of both? We're just going to really kind of dissect that bad boy apart. And then we also have another one, actually a new instructor for WCEI, Tracy Rogers, who just came on. We're going to bring her on because she's got a legal background. So we're going to kind of have one on the legal implications in wound care. And so that's upcoming here in the next, month or so. So we're going to, again, our goal is to probably turn out one of these a week. So keep your eyes on the Wound Care Gurus Facebook page or Instagram or however you're following us, and like us, follow us, because we're going to be putting out lots of great content for you guys.
That's terrific. I will definitely save the date on these. So that's great. Well, thanks so much.
Yeah, no problem. I'm going to bring up the thing because I think we had another slide to cover. Couple slides actually. I don't know. A lot of you on the comments. I mean, obviously, I know there's probably more people watching than are actually commenting. And for those of you that are alumni with WCEI, some of you probably know the infamous Scott Beatty. He has been with us not quite as long as I am. I have to say I'm still the veteran of the WCEI staff. I was Donna and Nancy's very first instructor to come on board. And Scott was one that came on within 2 years after I did. But he has just recently retired. Officially, he let us know that he is stepping away from going out there, and everybody, those of you that know him, love him. He is a complete, just high energy, fun love. I mean, you can't find anybody with a bigger heart who likes to just have fun, and you can really tell. I mean, in the early days, Don and Nancy used to tag team us together. We'd go down the road, and it was like nitro and glycerin. Putting the two of us in the room together, and we just had so much fun. We're really going to miss Scott. I know the industry will miss him. WCI will miss him because he really was an asset and an excellent instructor. So I don't know if Nancy or Denise want to share anything about Scott.
I can remember when I first met Scott, and that was just it. Full of energy, positivity, just love Scott. He's turned out to be a fabulous friend over the years. And I can only imagine what sitting in the classroom with both of you guys would be like. I mean, I can only imagine. So, Scott, if you're out there, we love you. Congratulations, man. Go live large.
Amen.
Mm-hmm. That's nice.
Now, the last thing we wanted to also just bring up here real quick is we would like to hear from you guys if there are any topics that you would love to hear about. So if you want to throw them into the comments, any topics, we will certainly make a list of those for potential future Facebook sessions, live sessions that we will bring to you, similar to what we did tonight with Nancy. So again, we would love any input so that we can keep bringing you guys more and more content. But we got one more thing for you. I know we've been going long, but we've been having a great time, is that we want to take some questions from the audience here,
Yeah,
So
you got
anybody
anything
wants
burning?
to type in a question, there's something burning on your heart, your mind that you're like, hey,
Yeah.
throw it at us. We'll take several questions here, time permitting, because we're not obviously going to go all night long. But throw some out there. If anybody has any questions, we would love to take some questions. Or obviously, you can certainly just keep throwing your comments and telling me how good looking I am and how great the two ladies make me even look even better because they're on either side of me. We'll certainly appreciate that type too. So other than that, Nancy, I'm just trying to think here. Anything going on with you coming up here while we're waiting to see if anybody throws a question up there?
Anything going on with us?
Yeah, just in the COVID. How's it affecting your life just in general?
My own life?
Yeah, your own life. I mean, we're all stuck in our homes. What have you been doing to, you got some stuff going on, I know.
Yeah, well, my house is very clean. And I would have to say that, Don and we started WCI about 17 years ago. And at the time we started, that was the time, I pretty much left my house. I haven't been in my house. I travel every week. So now I'm stuck in the house because of the quarantine. And I'm like, oh, wow. So I'm like decorating. QVC is my friend. I am buying so much stuff from QVC because I can't get out and shop. And I'm like, oh, I need a picture there. I need this there. So that's kind of what I've been up to.
I hear you. I mean, I can honestly say I have not been in my home for this long of a period of time, and I don't even know how, probably since I started with WCEI. And Denise and I,
we've been under the same roof longer this stretch than we ever have the entire time we've been married. And we're still not fighting. Isn't that great?
That's a good thing.
I know, right?
Yeah. Mm-hmm.
Hey, I see a question just popped up from Jackie. Okay. How long does it generally take to be able to determine if a treatment is working? I would just mainly say I think all three of us would agree that the standard rule of thumb we've always used is kind of the 2-week rule. Get up there 2 weeks. If you're not seeing any significant progress after 2 weeks, it might be time to go back to the drawing board. And like I always said, I know Denise has started teaching it since her and I have been working together. And I know my students have always heard me talk about the 6 basics of wound healing. When things aren't working, always go back to those basics to make sure you're actually addressing all the basics first. So if you don't know what those are, you can certainly reach out to us at woundcaregurus.com and we'll be happy to send you the list of what the 6 basics are.
That's a good idea.
Right.
And then
go ahead, Nancy.
Oh, and then just to kind of piggyback off of that is just as you check in the end of 2 weeks, what you're looking for is decreased size, decreased drainage. You might have had 100% necrotic tissue, but now you got 50, so that's considered positive. So look for all those signs as part of your assessment. And if everything looks good, keep going.
Yeah, 2 questions, Nancy, that came up about how to sign up for Vegas. Do you have an answer for those? Because I don't.
Yeah. Yes. Right, I'll be honest with you, the live events team has been working really hard here at WOW, and we should have everything going, I would say, like at the beginning of June. As soon as we know something, we'll post something on all our sites right away. But we're very close to going live very shortly.
Awesome. Excellent. The wonderful Donna. Gosh, I miss you, Donna. Haven't seen you in a while. I'm going to miss the fact that I won't see you at WOW this year either in person. But she asked if we're having live classes or just online. And actually, we're going to roll out first with mainly webinars, initially phase 1. But our goal is with phase 3 is to actually have some live classes on, more very specific type of topics where there isn't really a need being met out there. So.
And then also, we've had to postpone some of our sharp debridement classes, and we pushed them off through the summer, but we are coming back with those in the fall as well.
Exactly, yep. Fall's going to be stacked with classes. I think we're going to have about 8 or 9 classes in the fall. I mean, obviously, I've also offered at WOW. Unfortunately, you can't really do sharp debridement virtually.
Not the way we do sharp debridement anyway.
So unfortunately, there won't be that option for those of you that might have been hoping to get your sharp debridement skills checked off at WOW. So we've added a number of more classes in the fall. So hopefully those of you that are itching for that sharp debridement training, you can find a location that will work for you.
And if you have a location you want us to come to, just drop us a line at woundcaregurus.com and we'll be happy to bring those classes to you.
Excellent.
Okay. Was there another question?
I don't see
From
any.
Stacy.
Nope, I just see a bullous pemphigoid. Somebody brought it up for a topic for later.
All right.
So we will put that on the list. So
Speaking
I
of
think,
that,
yeah. So I think it's been a great night. We've been going for almost nearly an hour here. So we really appreciate all of you that tuned in. Be following us. Follow us on Instagram, Facebook, whatever your social media. LinkedIn, we're on there too. And just keep watching out. We'll be bringing you more and more content. I want to thank Nancy Morgan for spending the evening with us. It is an honor to have her on, and we will definitely bring her back again with some incredible topic that she will lay it out like she did tonight. So, Denise, is there anything you want to say as we wrap out here?
Just want to say thank you to everybody. We appreciate your support. We appreciate your time tonight, and we know how hard you're working in the field, out there on the front lines, and just to say, wow, we appreciate you guys. You're heroes. And reach out to us however we can support you. We want to be there for you. And thanks so much, Nancy.
thanks, guys.
All
Keep
right,
healing.
everybody. Be safe out there. Stay COVID-free. We miss you. We love you. God bless you all. Take care. We'll see you next week.
Keep healing.
Bye.